Good evening and welcome to another episode of Sense with Science. We are 11 episodes into the series, thanks to Pusat Perubatan Naluri, and we're also reaching out to viewers on satellite TV, courtesy of Astro Awani. This Hari Raya weekend, we're talking about something that many people don't realize as being of crucial importance in our fight against COVID-19. And it is something of a passion for Professor Adiba Kamuruzaman. So let's hear it from the lady herself. Selamat petang dan selamat datang ke episod ke-11 Sense with Science, Apa Kata Sains. Terima kasih kepada Pusat Perubatan Naluri sebagai sponsor siri ini. Pada masa kini kami juga menjangkau penonton di TV satellite dengan kerjasama Astro Awani. Di hujung minggu Hari Raya ini, kami berbincang mengenai sesuatu yang tidak disedari oleh banyak orang. Satu perkara penting yang agak penting dalam perjuangan kita tentang menentang COVID-19. Biarkan saya menjemput Profesor Adiba Kamuruzaman yang kini menjadi anggota Majlis Sains Organisasi Kesihatan Sedunia untuk berbalas dengan lebih terangnya.
Terima kasih Karen, selamat petang, selamat Hari Raya semua, and selamat datang to our special guest, Prof Sasheela from Pusat Perubatan University Blair, my very close colleague. Without her, I think we would pengsan at PPUM. She's been directing all the infection control guidelines. And Puan Serina Hijjas, an architect. And as Karen said, this is the first time that we're having someone non-medical, which is very exciting for us, because this afternoon we're going to be discussing a very important topic, which is the recent announcement by the World Health Organization and Centers for Disease Control in the US that the SARS-CoV-2, which is the virus that causes the COVID-19 pandemic, is in fact airborne. Now, this has been a controversy for nearly a year now. Of course, originally, I think all of you will remember back in March how people were obsessing over washing their vegetables and their fruits when they come back from the market. Some people I know leave their mail and newspapers for a day or two to get UV treated by natural sunlight, because fair enough, 12 months ago, a year and a half ago, we thought that the virus was mostly transmitted through contact, through touch, and through droplets. I'll let Sasheela later on explain the difference between droplet and airborne transmission in infection control speak. But now, the science, a year and a half on, I think it's very convincing that this virus is spread, certainly droplet, but also through airborne transmission, which means that it lingers in the air for a while. Now, this has a lot of implications in terms of how we orientate our prevention programs, how we move forward in the next many years in terms of preventing not just this current COVID-19 pandemic, but also future, touch wood, no more, but we have to be prepared for outbreaks such as this. So we are very delighted to have our two experts to share with us their thoughts on this, because this is really in a way hot off the press, because the CDC and WHO announcement only came out less than a week ago, Sasheela. Although, as I said, there's been controversy about this going on back and forth with particularly scientists, physicists, and people who do research in kind of airflow and all that, have been beating this drum for some time. Now, before I hand over to Karen and Prof Sasheela and Serina, I send greetings and apologies from Tan Sri Jamila, who is my partner in crime in this Sense with Science. We started this some months ago, and this is the 11th episode. She is, as we speak, I think, vaccinating people at the World Trade Center, and I believe Yang Amat Berhormat Perdana Menteri is coming. So she sends her apologies, but will join us as soon as she can. So over to you, Karen.
All right. So to help bring a medical as well as technical and design perspective to the topic of ventilation, we have two amazing guests on the show this evening. Serina Hijjas is one of the creative directors at the renowned architectural and design firm HIJJAS Architects and Planners. Serina has made a name for herself, changing the building landscape of architecture through buildings that are responsive, energy conscious, and striking. So she will be bringing her Green Building Index Accreditation Panel expertise to this discussion. Welcome, Serina.
Thank you very much, Professor Adiba and Karen. Really, not disappointed, but waiting for Dr. Jamila to join. She obviously has a very long standing in Mercy Malaysia and all the rest of her contribution in Malaysia. And I'm very excited to be here to contribute. Currently, I'm with the Malaysian Green Building Council. That's one of my volunteer works, and also with Green Building Index. And there's been a big shift with regards to the concern of health and well-being in buildings. So as we are adopting more green in design, we're also adopting health and well-being, and that's really becoming more central at the moment. So as we're speaking about this airborne, there's a lot of relevance here about health and well-being in buildings, our homes, and in our cities. Yeah.
All right.
Thank you.
Today's medical guest is an infectious disease physician. Dr. Sasheela Ponampalavana is attached to the University Malaya Medical Center, and she's a professor of medicine at University Malaya. She's currently the head of the Infection Control Department in UMMC, as well as member of the Pandemic Preparedness and Infection Control Coordinator of the UMMC COVID-19 Task Force. You know, these guests and their titles used to intimidate me until I realized that behind all these designations are women who care very much about the state of the world they live in. So welcome, Dr. Sasheela, to Sense with Science as well.
Thank you, Karen, and thanks, Prof Adiba, and hello, Serina. Nice meeting you, and I look forward to hearing what you have to say. You know, as an infectious disease physician, and many of y'all might be wondering what exactly we do. Well, infectious disease is not as glamorous, I think, as hematology or cardiology, as you have heard, but it's gained popularity in Malaysia in the last couple of years. I think 10 years ago, the only ID physicians you could count with one hand. I think Prof Adiba, Dr. Christopher Lee, Dr. Suresh, and probably 3 others were ID physicians, and now we have more, thankfully, now with the COVID pandemic. So basically what we do is we treat many infectious diseases like dengue, malaria, and HIV, communicable diseases, but also hospital-acquired infections such as osteomyelitis or an infection you can get in the hospital. And we also play a vital role in preventing outbreaks in the hospital with our colleagues in the infection control department, social and preventive medicine, and also our microbiologist colleague to safeguard our hospital from outbreaks of communicable diseases, maybe TB or hospital-acquired infections, both protecting our healthcare workers and patients. And now, of course, COVID, and it's been a big challenge. So that's what infectious disease doctors do, if you're wondering.
All right, cool. So completing our all-star lineup is, of course, Professor Dr. Adiba Kamurozaman, also infectious disease specialist and now WHO Science Council member. Prof Adiba, since you are the one who began sharing your thoughts on ventilation way earlier in the fight against COVID, why don't you start the ball rolling?
Well, thank you, Karen. Like I said in my preamble, I think a few of us, including Sasheela, have been very concerned about the possibility of this virus being airborne, which in its initial designation, it was considered a droplet, which means that these particles will hang in the air for a while and then, drop to the ground, and hence the rule of the 1 meter physical distancing, because the droplets will technically only go as far as that, and the masking and the rest of it. But now that we know more about how it's transmitted, i.e. that it's, especially when you speak or cough, that the virus is dispersed a lot further and can linger in the air a lot longer and remains in the air a lot longer, then yes, that distance still matters, but people beyond the 1 meter to 1 meter distance can also be potentially infected. And this comes from, really in-depth study of outbreaks and clusters. The earliest would be in a restaurant in China, where they kind of really looked at who became infected. And so it was clear that it wasn't just distance that mattered, but people who sat within the airflow of that restaurant from the index patient all got infected, whereas those, even though they were not even though they were within that 1 meter distance or 2 meter distance, but were out of that airflow circuit, didn't get infected. So from there, more and more studies, and likewise cruise ships also indicates that cruise ships outbreaks also more than a year ago also indicate that this could be an airborne disease, and simulations in laboratories have further confirmed this. So like I said, this has serious implications in terms of how we protect ourselves, what we advise the public, and in the long term, what we can do, to get the economy going again in terms of the role of architects and building engineers and retailers and all of that. On the other hand, also how we can pivot, the actions that we are taking because many of us thought that this is contact, and hence all that obsession with deep cleaning that costs a lot of money and causes venues to be shut down unnecessarily. So we've kind of been beating the wrong drum, I think, to some extent, and it's time that we get back on track to combat this pandemic. So that's my preamble. I think for more details, let's listen to our two experts and hear their thoughts as well, Karen.
All right. So, Serina, if you can just define for us what architects mean when they speak about ventilation, and tell us if ventilation is a big factor in most Malaysian homes and buildings. We live in the tropics. We are very lucky that we don't have to have closed houses because we have a very nice, pleasant climate for most parts. So do we think about ventilation as much as we should be thinking about ventilation? Has there been trends moving towards better ventilation, better ways of, airing buildings and places of residences?
Well, ventilation is about air change. It's about the air quality and air change inside the space. So when we talk about passive ventilation, we're talking about natural ventilation through the space. Now, in the tropics, we don't get so much air movement. For natural comfort, we really need something like for the science of it, 1.5 meters per second of air movement before we start to feel comfortable. Hence why, people put on fans, stay in shade. The Malaysian home, the old traditional Malay home of having the veranda as a social space outside actually has a lot going for it here and now. But when we talk about ventilation of buildings, we're talking about mostly air conditioning. And even in some homes, people have air conditioning. Some people sleep with air conditioning. I personally don't sleep with air conditioning and prefer just fan or opening up the windows during the night when it's a little bit cooler. So ventilation is in buildings about the air conditioning and cooling of air, and is what we call active system, the HVAC inside the building. And there are two types. There's one that's a sort of centralized air conditioning, which you find in malls and you find in office buildings. And then you have the split unit, which is basically those you have in your own homes, in singular rooms, etc. There are two different things that happens here. When we have ventilation in air conditioning in buildings, there is a certain amount of air purification. There is a certain amount of cooling down the air because we're in the tropics. And there's a certain amount of fresh air that's being put into cooling down inside offices and buildings. But when we talk about split units, there's no fresh air. It's really just circulating and cooling the air within the one space. So there are two aspects to that. And then we can cover that later on about, what can we do with regards to giving us better quality air inside space. Yeah.
Okay. So Serina, when you first heard about COVID being an airborne illness, did you think straight away that, we should have said a lot more about the role of good ventilation in the prevention of COVID?
I think, when the first ships were basically saying that the spread was quite wide, it became very obvious to me that it was basically because of the centralized air conditioning system. They might have sent food, they might have sent food to the room, they might have done all these kind of things, but we had a centralized air conditioning system, just like you have on an aeroplane. And so what becomes very evident to most of us in the industry is that we actually need to think beyond in terms of how we filtrate that air and recirculate air inside the office or inside contained spaces, because this is possibly the way, and now mentioning it, that is finally airborne is making a lot of sense. And so what going forward, I think you will hear is that there's going to be a toolkit of things that we can improve our air quality inside our offices, apart from social distancing, the mask, the sanitization, the self-sanitization. People are getting this sense of familiarity, like I'm going to the office, I'm working with the same people, I'm actually going to be okay. But for those who know, it's not necessarily so. We're in an office building where the floor above, level 33, has a COVID case, or level 25. Fortunately for us, it's a floor-by-floor air conditioning system and not a centralized building air conditioning system. So there's some containment in that. Yeah. Okay.
So Dr. Sasheela, I have a question, and it's this. We talked so much about a lesser means of catching COVID is that if you touch a surface in which droplets of infected fluid have fallen on, right? And contact with hands, and then the hand to mouth movement can also spread the COVID virus. But in your view, has so much emphasis been placed on the physical hygiene, the hand sanitization, Lysoling everything before you bring it to the house, to the point that the importance of ventilation has not been discussed enough?
Well, I must say COVID has been a very dynamic disease, isn't it? It was something new. None of us knew about it. We started off, knowing nothing about the disease. We started off with the highest infection control measure, which is contact, airborne, and droplet. Then we slowly started taking off one by one. We protected the hospitals first, and then, community transmission, sometimes takes a different approach. So over time, we have learned a lot. And I think that, to combat this virus, we need to use all our tools. One is not more superior than the other. I think hand hygiene will always be one of the most important tools in infection prevention and control, no matter what the organism is. It stood the sense of time. So we still use it for influenza, for rotavirus, any sort of infection. Hand hygiene is paramount. In any sort of respiratory disease, including COVID, your cough etiquette, with this COVID, this virus, it is droplet as well as airborne under many circumstances, as we understand now. When someone speaks or cough, whether it is aerosol or whether it's droplet, it depends on the type of activity one is doing and also the place where someone is. For example, whether you're coughing or not talking at all, or just breathing or singing, or shouting, it depends on what sort of activity you're doing that can generate an aerosol, and that causes the virus to be in smaller particles and therefore linger longer in the environment, as Prof Adiba had alluded to. So in view of that, and also, it all means what is very important in this sense is ensuring that the concentration of the virus is minimal around us, because for someone to get infected, there's many factors involved. One is the concentration of the virus that you're inhaling. Number one is how infective someone is, what was the activity, and what is the amount of virus that you are exposed to. So even if in that case, if someone is cleaning the environment is also important, but now we know ventilation is equally important. So we need to use all the tools that we have. I wouldn't say that we have been barking up the wrong tree. We're barking up the trees as they came along, and I think now we have to pay extra emphasis on ventilation, because WHO has already said so. In fact, a couple of months ago, WHO came up with a roadmap on ventilation, which is very important, and I think that should be part of our guideline now. So it's hand hygiene, cough etiquette, social distancing, masking up, taking care of your ventilation and making sure that that you're not in a confined space, is adequately ventilated, as well as vaccination. So only with all this in place, I think we will be able to live with this virus. I think I always believe the bacteria and virus will always be one step ahead of us. So we should need to learn to live with it.
All right, Dr. Sasheela, we have a personal question. One of my more elderly friends who is tuning in on his handphone has asked, does this mean that there might be a possibility that outdoor activities now are curtailed even more? Current SOPs still allow walking in the taman by yourself, or biking, two people with enough of a distance between them. He's now asking, because it's airborne now, and people necessarily breathe harder when they are walking uphill, whether there might be a reason for the government to cut down on these allowables.
So that's a very good question. So I think almost all of the outbreaks that we have seen currently have been confined to indoor activities. We don't see things happening while someone is jogging or cycling or camping or trekking. Of course, when it's associated with these activities, it's probably because after someone does an activity, they go to a pub or a bar or teh tarik, and probably that's where the transmission is occurring. But none of, as Prof Adiba alluded, most of this transmission had occurred in restaurants, had happened in churches during a choir session. It has occurred in buses, when people went, there was an outbreak in a bus when, they were going to a temple. I think it was in Taiwan. And the people who actually sat next to the window did not get infected. Whereas those who sat at the back of the bus, but, were not next to the window. Exactly. So it just shows you how important ventilation is, because at the end of the day, it's concentration. So if you were outdoors and you were talking and you maintain a certain amount of distance, the air gets diluted before it reaches you, because a certain amount of concentration is needed for infectivity to happen. And I think there are studies now going on even in US looking at schools. When they open the window or the ventilation rate is a certain amount, then actually the risk of transmission attack rate reduces. So it is just showing that our idea is to dilute the concentration of that virus. So outdoors, if you're jogging, again, you keep it to small numbers, keep your distance, but as long as you're jogging and you're on the move, it's all what we call a casual sort of contact, and you probably wouldn't transmit the infection. And I think that's very important. In fact, and I think, lots of people are doing the things that they're doing now is because they don't understand the concept of this. And that's why they go to confined places. But, I still see people jogging, wearing their mask and cycling. And in fact, a colleague of mine said his helper had cycled to the sundry shop to get something, and she was masked up and actually collapsed because she couldn't breathe of hypoxia. So, it's, I think we need to be rational in what we do, and we understand more and more about the virus. And even in the hospital setting, what we have seen is most of the transmission or outbreaks that happened in the hospital was not in the COVID ward, all right? It was happened in pantries, when, it was small and closed, confined space. In the wards, we have an air exchange about 6 to 12, but the pantry air exchange is much lesser. And that's why I think it has led to these transmission, because of the concentration of the viruses in these confined spaces, and it's not allowing it to get diluted. So I think looking at all this, it's aerosol, but I would say it's a short-range aerosol. So far, they've not seen it going from one floor to another. Even when it happened in one floor. But we don't see people getting it in the lifts or on the ground floor, because in the lift, one of the things that's important in the lift, though it's a confined space, you're not there for prolonged periods of time. And if you're wearing your mask, you're not speaking loudly. In fact, that nowadays, I've seen in certain areas, is you use the stay quiet in your lift. So you don't talk much, you don't spew out. So I think a lot of things, so I think what are the risks of transmission is confined space, crowded area, high concentration of the virus where there's inadequate ventilation, and prolonged periods of contact associated with the type of activity and not using a mask. So I think if we have all this in mind, we would know where it's safe. So going to the park and exercising, I think please go ahead. In fact, that should not stop at all. We keep it to small amounts, but the teh-tarik session after the cycling, the golfing, and the trekking, it's a definite no-no.
All right, that is an awesome answer. I mean, this is why Sense with Science was originated. I think this is one of the reasons Tan Sri Jamila and Prof Adiba decided to come up and pilot a series like this, so that we hear from the medical professionals are chosen and selected for their ability to distill the essence of medical knowledge into layman's speak. Thank you so much, Dr. Sasheela. There is another question on Facebook. We're buzzing today. What is the best control mechanism for ventilation for a COVID ward? Air conditioned or natural ventilation? This is kind of a strange question, because it's really hard for hospitals to actually have natural ventilation. Maybe Serina, you want to take that, and then followed by both of our infectious diseases experts.
I think, you're finding smaller hospitals or clinics, the ones outside of the city centers, like Perak or whatever, they may be less air conditioned and naturally ventilated. Air movement is important, but the densification, as was mentioned before, and the science behind density of people, increased introduction of outdoor exchange is really important. Improve central air filtration. Consider a portable high efficiency particulate air filtration to enhance the cleaning of the air on higher risk areas, especially, and also consider ultraviolet germicidal eradication, which is basically UVGI. So we're moving forward, for example, in concentrated areas like hotel rooms, for example. We really should be considering basically introducing UVGIs into those spaces moving forward into the future, just to ensure that we are not in the same situation as a confined. And as mentioned before, it's really the confined long periods. When we go into a lift, as was mentioned by Sasheela, it's really air extraction that they're doing. They're actually bringing the air through, but air extraction, and therefore they're not pumping air inside that space. So yeah, you're in there for the for the 1 minute, perhaps the longest to get down, and therefore there's not a problem. If you're passing through a space, it's not a problem. The running, I believe also the same thing, that running is not a problem. It's really about densification of people inside spaces, of indoor spaces. And so what you're going to see future-wise, I hope, is airlines, the mass transport. The mass transport looks at capacities inside each train. and looks in terms of aeroplanes for the mass, especially cheap airlines moving forward, and also look at their air filtration system that they're introducing inside those spaces. Very important.
Okay, so here we have...
Karen, yeah, if I may jump in. Hi, Tan Sri Jamila, thanks for joining us.
Nice to meet you.
I just want to continue from where Serina has just left off before I forget. I think, you know, the restaurant industry and also gymnasium owners have been very, very badly hit by the pandemic, you know, because they've not been allowed to have indoor dining, etc., etc. And I think in the UK and the US, at one point, even in the middle of winter, they moved to outdoor dining, whereas here in Malaysia, it's the heat and the rain that stops us from doing that. But I think some modifications in restaurants, coupled with perhaps reducing the density, might be a quick win, quick way forward, don't you think, Serina? Rather than, you know, having a no indoor dining for the longest time. And what would that modification be?
I think, you know, here's some quick wins, you know, doing a bit more of a hybrid cooling instead of the normal air conditioning inside the space. You know, having some air conditioning to cool down, but having air movement that basically is going to be flushing out into the open. But yes, more outdoor eating. You know, I think what's interesting that's happened in Singapore is that the new living room is now the outdoor space. And so the parks have seen a proliferation of people, you know, nature's natural filtration system is happening out there. But even in their small confined spaces, people are greening their environments, planting vegetation as a means of a sort of escape, but filtration system. I think we're going to see more of this, which is a good sign. But hybrid ventilation, you know, we live in the tropics, 365 days, we know what the temperature is going to be. I have to say this again and again, we do not know how lucky we are. Yeah. Temperature is our benefit in this case. Of course, humidity makes us sweat. So we need to have the shade, the ventilation, and being outside a lot more. If we're going to meet in a group, then make it be outside more than internal. Absolutely.
Okay, absolutely. So the progenitor of the show, Tan Sri Jamila Mahmud, is finally here. She's logged on from the World Trade Center.
Yeah, I'm so sorry I'm late, but I couldn't miss this episode and really so excited to see Sasheela and Serina join us. Thank you so much.
Thank you,
and spot on, you know, really we've got to rethink how we do our work, how we live. So this whole issue, I love that the living room is outdoor. Absolutely. I think for those of us who can afford to do that, some of us have houses that have balconies or have outdoor space. I think that's very easy to do. But I think for public housing and so forth, I think we've really got to push that people can actually go out to the parks and you know, and go outside their buildings and, you know, have walks and, you know, be able to eat outside and so forth. And I cannot agree more that, you know, even dining, you know, entertainment has to be adjusted. I've been telling my friends who own gyms that they've really got to start thinking about doing more of these group exercises outdoors, right? I mean, if you live in Europe or the US, you see a lot of people doing yoga and aerobics and stuff in the parks. And I think we've got to maybe embrace that a little bit more.
All right. Dr. Jim, before we continue, you were actually on the ground working as a vaccinator today.
Yeah, it's crazy. Yeah, yesterday Yeah. So I'm at World Trade Center where we have to scale up vaccination. I mean, if we want to beat this, we've got to get more vaccines into people's arms. Yesterday, our target was 8,000. And believe it or not, despite all the chaos, we managed to do 8,360.
Wow.
And, you know, my back hurts, my feet hurt, but we're still going. And today, I think we will beat that record. So, you know, it's so orderly today. The police have come to help us manage the crowds. Everyone's leaving with a big smile on their face. It's been very, very efficient, and the volunteers have been just wonderful.
That's amazing. Okay, just on a glib little aside, Dr. Jim, how many people did you personally chuchok their A's at?
Oh my God, so many. So we have my room is called the Kiasu room. Instead, everyone has 2 vaccinators in their room. I have 3 because I roped in my husband as well. So he has no choice but to spend the afternoon with me vaccinating people. So we're doing a lot. We in about 2 hours, we've done, I think we did 120 in 2 hours. So we're going breakneck speed now, and everyone's, you know, and also counseling them and listening to people. But I think the mood is very high here. Everyone is so fired up. You know, everybody really believes that it's so important for everyone to get vaccinated. So, you know, we really hope that everyone will get vaccinated.
Okay, Dr. Jim, in a recent episode, you mentioned that you were especially worried about the COVID clusters which have developed in workplaces. And can you walk us through your concerns again and explain why you already saw this as a red flag before we begin to even start talking about ventilation and safety?
I mean, let's face it, right? For the longest time, we were talking about droplet transmission, whereas, you know, a number of us were saying, no, it might be airborne. I still remember Adiba and I, in a very early episode of Sense with Science, we actually talked about this. We mentioned that, you know, we don't know whether it's airborne at the time. And then we had this, you know, wonderful Spanish article that talks about risks in terms of how you sit, your spatial arrangements in the house, you know, the windows, ventilation, and so forth. So I think it's clear now that, you know, in workplaces, let's face it, they're quite slack on SOPs as well. And the places they catch COVID is actually when they dine together in small pantries. And it's human nature. You eat, you talk. And getting people to open their windows at work, even I get sometimes, you know, told off because why are you opening the windows in an air-conditioned government building? And I say, well, because it's good for me and good for you. But this whole mindset needs to shift, right? How do we make sure that businesses and offices really try to adhere to the 30% capacity, minimize the number of people in the workplace at any one time, open the windows as much as possible, invest in a good air filter, you know, manage your airflow, blow the fans in different directions towards the windows, for example. So there are things that you can be done that, you know, reduce your risk. And, you know, wearing a mask indoors, I mean, just because you are among friends and among colleagues, it doesn't mean that you don't wear a mask in your workplace, unless you're all fully vaccinated. That's a different story. But I think, you know, we have to adjust our behaviors and we have to adjust our office spaces. So I think, you know, a lot of offices now have to rethink how they arrange their office space. So do you think that's where Serina comes in?
Yeah, that's right.
Well, no, the good news is that, you know, somebody told me that the whole of Petronas is basically all working from home. There is basically 95% of them are working from home. And maybe there's a few 5% that go in, but essentially they're all working from home. We've had a mix of that, but our densities are pretty low inside our space. And so what used to be, you know, the science of it is 10 meters per person inside an office space may need to go to 20 or 30, you know, in terms of office planning. Professor and Tansri, you know, when you mentioned about office spaces, unfortunately in the sort of corporate design of buildings, most of it are glass buildings, and most of them you can't open the window. It's really a brick glass for emergency only, and so people can't open the windows. It's only really in lower density buildings that actually have this facility of opening the windows, and the reason for that is humidity control. We have an issue of humidity in this climate. So I think to mitigate that, we really, as you mentioned, it's a multi-layered. I've seen the CDC report on ventilation, which is amazing. And they have actually started to give the guidelines and the layered approach to how we can do the filtration. So doing all the things you say at the first hand, and then on the second layer is the air filtration and the UV and density control of people. But working in this virtual environment now will give us this flexibility. I think it's here to stay. I think we're going to still see 20 to 30% of people working forward into the future, working from home and only occasionally meeting. And then how we meet is also going to change. Yeah.
All right. So, Dr. Jim, there was just a question on Facebook that said, so with this new information that we're getting, would you say that it's still safer to work from home? This is a blanket question, of course, depending on the size, as Serina has said, of your task force, of the number of people in your office, your shared space, how many people eating in the pantry. But as a blanket, Dr. Jim, what do you say? Work from home if you can?
Yes, I think work from home if you can, and even at home, make sure that the same rules apply, the ventilation, the spacing, and so on and so forth. On another note, that's completely non-COVID related, I can't help feeling that this is such a good thing for women, right? Because women, as they advance in their careers, they have family, to take care of and so forth. And this working from home concept in Malaysia was actually quite difficult. Many employers still want to see their staff in the workplace. Whereas, where I used to work in Europe, it was very normal for my staff to only work 2 or 3 days in the office so that they could tend to their kids, right? So I think, I see this as a really good new way of working.
All right.
Except for extended work hours. We're working longer.
Right? You have to work so much harder. Yeah.
Absolutely.
I think it's discipline. Just as you have to discipline yourself in terms of, ventilation of the room and so forth, we have to discipline our work hours because we have to take care of our health, our mental health. We can't get overwhelmed. I mean, it's easier said than done, but, we've got to set some rules for working from home. Maybe we can have an episode on that. How do you work from home safely, right? Not just in terms of physical safety, but also mental health, emotional health, and all that.
Dr. Jim, I'm sorry, but I'm calling you out on that. That is pure, you said it, but you and I are having chat exchanges at 5 o'clock in the morning. What is this about controlling work hours? Huh?
I'm a morning person. I can't help it. I'm up at 4:30 in the morning, right?
You and I. Okay, ladies, another question. I'm going to open this up to the professionals now. Someone on our Facebook feed asked, is it safe to go for a dental appointment?
Same question
as I think currently with the community transmission being high, most of our surgical procedures are for elective cases, and dental procedures are mainly aerosol generating. So I would say if you really need a dental procedure now, then please go for it. And then there's protocols in place, you get tested, or the doctors will then take the necessary precaution that's needed. But if you think you can hold it off, then you hold it off. But that's how it is right now. So it depends on how severe your condition is.
Okay.
I have a question. Seeing how it's spread in India so rapidly, is it waterborne?
Waterborne.
Is the disease waterborne as well? Because I mean, the way it's spreading through India is giving a layperson the impression that it may also be waterborne.
I think it has been found in sewage, but so far there is no evidence there's oral fecal transmission of this disease at all. I think it's still respiratory bound. I think in India, because of overcrowding, confined spaces, I think that has led to
and no masks,
or the poverty.
too poor.
Has led to it. Yeah.
I think, Serina, you and I are probably thinking about that mass religious festival that they had, when you had like 34,000 people just thronging the Ganges, That's really a recipe for disaster, even though it's held outside, correct? Because I mean, that number of people, you just can't handle that.
Yeah, I mean, the bathing in the river is just one part of the thing. It's called a Kumbh Mela. It happens every 12 years, but it's after that. They go and sleep in confined areas. After that, they don't sleep in the river. They go back. The dorms are crowded. I have witnessed one of it many years ago. It's very crowded. Where they live, where the prayers are done, and it's in a confined place. The only thing that's outdoor is bathing in the Ganges.
Which comes to another point, which is dormitories and our factories and our construction sites, where we have workers come in for working, and the closed dormitories that we keep, and of course their eating areas. I think this is one big area that really needs to change for us. I think we saw a huge spread in December, January, due to factories, including the glove factory industry, which was hard hit. But on construction sites, being familiar with construction sites, we're seeing quite a spread of this. So I think we need to think about the livability of these places for workers as another key area.
Absolutely. Which again also leads us to our next question that we've had on our Facebook. Serina, I told you the reason why we decided to extend the session was because of the number of questions we anticipated, and it's true. There are so many questions right now, and they need your input. Serina, specifically, we're talking about preschools now. A question on Facebook says, preschools are still open. Why are they open? How can they ensure that ventilation is good in a preschool? And perhaps, Serina, from your point, you can speak to preschool owners and maybe some tips on how they can increase ventilation for better.
Well, I think it's preschools and schools. I have my two nephews live next door. They're 5 and 7. They're going to school when the school doors open, and I'm sure others, and their dormitories as well for sekolah ugama and all the rest of it. I think there are different precautions we need to take when it's both across of living as well as schooling. I do think that it may still be too early to be opening up our schools. I don't know if Tan Sri agrees with me. It may be that they come home and they spread it. They may not be as infected as the others sometimes. So I think that it's really too early to be opening up the schools. It's a trouble for. I also have kids that are in university and they haven't attended university in over a year. And definitely the contact time is affecting them, the non-contact time. But I think it's really important that, especially when we're looking at private schools where it's air conditioned inside the spaces, the containment especially in nurseries where the kids have to stay over for the day, and their sleeping arrangements as well as their going to the kindergarten. I think it's unfortunate, but I think it's too early to let them go back in. There's no amount of control you can do because they are too small to know what needs to be done and to hold their mask and all the rest of it. Yeah.
They're actually on the issue of school opening or closing, because this is a really another contentious issue, because the damage, the long-term damage to children of not just the acquisition of knowledge, but the lack of social interaction with their peers and other children serious concern to many pediatricians and study childhood development. But there are kind of guidance, I guess, from UNICEF, WHO, in terms of how you adjust school opening and closure based on the level of community transmission. And you're right, I think right now in Malaysia, in many states, we have very high level of community transmission, and therefore it's not advisable to open schools. And therefore, we need to bring that level down as quickly as possible through testing, isolating, and vaccinating. No two ways about it. Yeah.
I also think, the rural schools, in the sense, most of the schools are not aircon, the doors are open, and there are limited number of students. So I think social distancing is still possible, and I think we should get our teachers vaccinated quickly as well. I think that's a very important population to get vaccinated. I have schools going children as well, and I think without this education as total interaction, I think it's going to be very detrimental to their health and if not education. So I think one of the things that we really need to look into is how we're going to open up schools. And I think CDC has got a very good guideline on this. And I think we should quickly start coming up with one, not waiting till our numbers come down and then think what we are going to do. We should start working on what we need to do now. For example, in CDC, it states that if your community transmission is this much, what should schools do? If your community transmission is this much, what you should do? And that's what we need to come up with quickly. And I think we don't need to reinvent the wheel. The guidelines are already out there. Take the CDC guideline, adapt it to what we have. And I think that's what we need to do right now. And I think that's one of the things, we have to be proactive rather than reactive, wait for one thing to end and then start another thing. And I think it's very important. And I think this is one of the things where school needs to look into how they're going to reopen, looking into their ventilation, even if they're air-conned. Sorry, Serina, maybe you will be able to explain this better, but looking at their air exchange, I think US schools are beginning to look into that. I don't know. I think these are some of the things we can do.
Yeah. Most schools are basically still using, split units because that's the most economical. So actually, in this case, as you say, schools are pretty good because you don't have, you have mostly hard surfaces in there, which means that it's easy to clean, it's easy to wipe down. There's nothing that can stay, there's no carpets usually and all these kind of things. So the environment is there. I think we can cool it, but we'll have to open the windows and allow for hybrid with fans, ventilated, or just have the windows with the fans, as you mentioned, and maintain a lower density inside classes. So if we need to switch back, most of the schools are in morning and afternoon sessions to keep the densities down, then that's probably the way to go. But adopting, it's really good that you say about adopting the CDC schools template, I think, to the tropical and cultural environment that we have. I think that can be quickly done, and it's something that we can filter through to the Architects Association and get it out there as guidelines.
I think that's the same for retail and buildings in general, that we desperately need standards and guidelines that's adapted to our climate.
Serina, I was going to ask you about air quality using the carbon dioxide level. I think that was one of the things that I've been seeing in some of the recent ECDC guideline and even CDC, I think, talking about using carbon dioxide level as a surrogate for air quality. What is
I'm actually unfamiliar with the CO2. I mean, we have actually introduced CO2 sensors. Usually we're trying to reduce CO2. We have CO2 sensors. We have carbon monoxide sensors inside spaces. we've introduced that through Green Building Index in terms of checking the air quality and the air quality in return through the air ducts. Most important for us, I mean, I think we missed some of the questions earlier about, what happened when we had a bad air qualities inside our buildings, where we had the sick building syndrome, essentially. And that happened due to a lot of humidity and stale air, and sometimes in the installation when it's damp, and we actually have not done the flushing out properly of these spaces. So the dampness is not great for us. The heat is great for us in this situation. So really, we have to look at how we control that and the particulates inside the air. Yeah, but having the sensor control of the air coming through the ducts can be done, so we can actually monitor the air quality, and that's introduced to higher performance buildings. So we're coming through to hospitals, and we'll be looking at much higher quality of air control, especially because we have people who are sick inside the spaces. But I think going forward, I think there's going to be some changes with regards to the guidelines to air quality. We're going to have to take the next step up of clean air or filtration.
So this is addressing our Facebook viewers. We've seen your questions. We're reading through them now. We're going to try to answer as many of them as possible. We thank you for your interaction. We're going to get to them, okay? So ladies, we've got a backlog of questions. So let's do this a quick trigger way. What is your advice on the practice of diffusing essential oils that claim to purify the air? Is there such a thing as oils that can purify the air? Doctors?
Quick answer, no scientific evidence.
No.
No.
All right, jury is completely in agreement of this one. And
Take
Serina,
your money and buy an air filter.
No harm using it. It smells nice. I use it because it makes my room smell nice.
No, I mean,
It's no harm using it. I do have essential oils inside the house sometimes, but it's not you can't rely. It's not something I can say 100% it's going to be effective. It's almost. I am a homeopathic baby, so I am fully and 100% homeopathic. But I do believe that if you need to take the prevention, allopathy is there. And so things like vaccination is important. There was a jury out about, vaccination is going to change your immunology. You're not going to be able to effectively defend yourself because your cells, it goes down the whole question of all of this. I think vaccination is important to be out there. Essential oils can enhance the space, but it's not there to be fully protective to you.
absolutely. I think as an all-women panel show, we all think that it's great to have something that's nice smelling in the house. Great if it's some kind of natural healing properties, but trust the science, as Tan Sri Jamila will say. Trust the science, and right now you have it from 3 very, very good doctors that there is no scientific evidence to whether it can purify the air. If you need to purify the air, an air purifier is a much better option. More on that later. Again, to our Facebook viewers, we are looking at your questions. And question 5, is trekking and hiking encouraged during the pandemic? We spoke about this at length earlier on in the show. Please scroll back to the show. The answers are there. In short form, yes, it is encouraged because you need to get out. You need to take care of your personal mental health, and you also need to enjoy the outdoors. But do it safely. Our guides are early on in the show. Question 6, addressed to Professor Adiba and Dr. Sasheela. What is your opinion of the AZ vaccine for young women? I have a 22-year-old daughter, and I'm concerned about some of the reports about the AZ vaccine. I think, Dr. Jamila has just been vaccinating on site. Both Dr. Sasheela, Dr. Adiba are familiar with the AZ vaccine. So perhaps doctors weigh in your own time, please.
Yeah, we're off topic a bit, but I think this is an important hot topic. Just very quickly, yes, with the AstraZeneca vaccine, there is a very rare but serious, what we call adverse event that's known as the vaccine-induced thrombocytopenia syndrome, where you develop clots, and it could be clots in the blood vessels in the brain, it could be clots in any part of the body. And intensive investigations where these have occurred suggest that the risk of this is higher the younger you are. So what we advise is you've got to balance the risk and benefit with any vaccine, not just with the AstraZeneca vaccine. So with a 22-year-old, the risk of getting severe COVID is low compared to someone who's 60 with diabetes, etc., etc. So some governments, like the UK, are now offering an alternative vaccine because they've been, really vaccinating their population using AZ for the most part, but now they've have switched to offering other vaccines for those 40 and below. In Malaysia, we now have we don't have that luxury in terms of the different types of vaccines. We have Pfizer, we have Sinovac. So I would be very, very cautious about giving a vaccine to a 22-year-old. Although the risk is small, the risk is rare, but the risk is serious. As opposed to the Pfizer vaccine, I'm not wedded to any of the vaccines, I'm just giving the facts. The Pfizer vaccine with its 4 in a million anaphylaxis, now that occurs in the first 30 minutes of giving the vaccination, and that's why we ask you to remain in the vaccination center if you have a history of allergy for 30 minutes. If you don't, we say you can go home after 15 minutes, because that allergic reaction is not easily reversible. We can give you epinephrine, and hopefully, although it's life-threatening as well, that's easily reversible. Whereas the clotting, if it occurs, let's say, in what we call the cerebral vein, you may present with severe headache, etc., can present anywhere between 4 days to 30 days. There could be delayed diagnoses, people may not be so familiar with it, treatment may not be so easily available. So I'm naturally a cautious person, and I would caution a young person. I mean, Tan Sri Jamila, you're much closer to this than I am. You may have a different view, but that would be my take on it.
Yeah, Adiba, when we are faced with a situation where the numbers are really escalating, I think sometimes we have to make some choices. Of course, I completely agree. If we had a choice, then Pfizer might be superior to AZ in the very young age group. But it's all about, those calculated risks you take. I think that moving forward, sorry, I'm sitting in a corridor and sitting on the floor right now, so you might hear some interruptions. Moving forward in the next phase, when we get our next batches of AstraZeneca, we are probably going to focus those on the older populations and then reserve the Pfizer and Sinovac for the younger ones. When we opened up the first phase of AstraZeneca, we actually held on to NPRA and WHO guidelines, which say anything above 18 years old can be used. But as more evidence comes, as we see more evidence emerging, we now have a choice, because we will be able to have more Sinovac and Pfizer soon. So for those who've taken it, it's fine. We know we are within WHO and NPRA guidelines, but I think moving forward, AstraZeneca probably will be reserved for the older age groups, and then we'll, prioritize the younger ones to take Sinovac and Pfizer.
Yeah,
okay,
I think
absolutely.
that's great and sensible. Yeah.
Yeah, ladies, again, I would like to tell our Facebook viewers we did a targeted, very, very thorough session on vaccinations and vaccines that is available on Facebook. We will post the link to that particular episode in the chat so that all your vaccination questions and about timelines, about who takes what is going to be answered in that episode. Today, we're going to talk about ventilation and we will continue with that topic. So there is a question about a house full of carpets, curtains, and cushions. What do you do with that when it comes to ventilation? I just threw out everything.
Who just threw out everything?
I did, Serina.
Oh, I see. You know, I have the single carpet in every room, like most Malaysians. I think middle-class Asians probably have a carpet in their room because they want to feel something softer on their feet, or they have timber floors. I say restrict it and just try to reduce the amount that you have, just because anyway, allergies of any kind, you know, have actually come up because of carpets, you know, and if you haven't properly cleared it and all. So I think this is just normal hygiene. Try to restrict and reduce the amount of carpets that you have. And certainly
any kind of soft material in the house that can attract dust and can breed dust mites. Dust mites can lend themselves to a whole host of other little nasties and uglies. You don't need complications in this time. You don't want to be going into hospital for a respiratory tract infection caused by dust mite allergy. So, you know, do yourself a favor, do your doctors a favor, keep furnishing to a minimum. If you need to have them around, beat them out thoroughly. You know, take out your frustration about not being able to go to your favorite mama on your carpets and on your soft furnishings. The next question, landed house full of air and gardens. What about those who stay in apartment and condos? How can they protect themselves? How can they up their ventilation flow and safety?
Well, you know, in the tropics, cooling is you know, nobody likes to go out at midday running except for the individual matsales that may go out running. The cooler part of the day is usually after 6 or 7. And here's a rule of thumb. You actually start to open your windows after 5 or 6 o'clock. And that's the best time to sort of get the air through the space, as well as it's slightly cooler, less humid in that time of the day. Of course, if you've got planting and you're on the ground, you know, there's a rule of thumb that you try to keep clear lawn areas and a lot of the greenery just slightly away from your windows, because, you know, a funny thing happened last year was whilst this whole COVID thing happened in March, apartment buildings had, you know, we had a problem with mosquitoes, and we had, you know, malaria and things like that, you know, coming up, Aedes mosquitoes, and they had to actually fog some of the apartment buildings. And I think that's also to do with containment of water, obviously. And so our threat in the tropics is still this. So we have to have considerations for that. Yeah, just open your windows after 5 or 6 o'clock just to start to get the air movement through your space. Okay. That's the best time, and it's slightly cooler.
Are personal air purifiers a good investment?
Yes, I think so. We've had our fair share of air pollution and smoke and fire coming across from Indonesia, where we had very bad air quality inside our space, apartments or houses. So air filtration system, but again, you know, let's just be quite sensible. If we're in residential housing, it's very easy to open your windows, get your air fans going. The other thing about what CDC was saying also was not to have the fans going at very high speed and circulating it inside the space, but to actually have it more open. Slower flows to sort of just get the air movement through. So these are some of the CDC guidelines with regards to ventilating, even with fans inside the space.
That's awesome. Thank you so much, Serina.
Serina, sorry, Karen, in terms
Go
of
ahead.
fans, if I'm not mistaken, both CDC and WHO, the placement of fans is also very important.
Yes.
Isn't it? So
To
that
to
it
well,
blows up, yeah.
not all of us have that luxury because we've all put ceiling fans, and it's obviously always in the middle of the room. So if you have the placement is important, that's true. If you can have the low fans that are blowing out the air rather than circulating, basically blowing out the air so that we actually get the movement and basically flushing out your space. So much the better. But most of us have only the ceiling fans, and the secondary fans are really only when we're having a festive occasion where we actually need to sort of cool down our feet. Something that doesn't happen here, but low fans and fans where the feet are basically just to flush out is really quite good, a good method. In our dining hall, dining place in my parents' house, there's actually an installed fan that is blowing underneath onto the feet and blowing the air out and away. So it's very unusual, but it actually works very effectively. So it's a different way of ventilating.
I think the other thing also to point out is, CDC and WHO and other guidelines have mentioned about toilets. So, especially in public toilets or even the house, how the ventilation should be, and ensuring that the toilet area is a bit more negative pressure, so it's contained in there, and flushing to close the lid to prevent aerosolization. So this is, if for industries or public areas, I think that is another area that we need to look to ensure the toilets are contained as well.
Oh, that's a very, very pertinent share, Dr. Sasheela. Thank you. Professor Adila, last episode you spoke about your concerns that you were seeing more and more younger patients in your wards. Dr. Sasheela, are you seeing the same trend? Are COVID patients getting younger? The answer is yes, of course. But do you think it has anything to do with lockdown rebellion and choosing to go out to gather in cafes and restaurants when we could, all air-conditioned spaces, which may be optimum places to catch the COVID virus?
Well, we are definitely seeing younger patients, and we are not different from the rest of the world. I think that's reported everywhere in US or UK. They're seeing more in campuses, and the youngsters going out more and getting more infected. But I don't think it's so much to do rebellion. I think it's just fatigue and people are tired. You just need the human interaction, and after some time you just need that more than the fear of COVID. I think the other thing as well is the lack of understanding on why they're doing certain things. I think if people are clear on the hows and the whats and the whys, I think then they'll be more rational and they will do what is necessary. So right now people are, they feel that they can't jog, they can't cycle, they can't go to a cafe. They've put everything in the same box rather than saying like, okay, if I can go cycling, but I have to be careful in the cafe. I think people will be more rational that way. And so I think more education needs to be given to the younger crowd on what are the risk factors that are associated with increased transmission. And I think then they can make a calculated decision. And I think, just saying no is not going to stop, it's not going to stop people, but giving them an alternative. I think as an ID physician, I think we learned it with sex education, isn't it? You can't tell people abstinence is going to stop HIV, but you tell them use condom and that would stop HIV. I think we just need to be rational with our advice. So you don't tell them you can't go out, but if you go out, don't go in big groups, go in an open area, find a safe spot, a cafe that it's outdoors, wear your mask until the food comes, continue to wear your mask, stay in small crowds. If you're sick, don't go out. Hand hygiene is still paramount. And I think if we tell people this clearly, I think they will follow.
That makes
Prof,
so much sense.
Yeah. I always go back to our HIV. In fact, when COVID first started, I said, Prof Adiba, this is so much like our HIV. The fear,
Wow.
people didn't want to take care of patients with COVID. Only the ID physicians went forth. I think it's a lot of like any other communicable diseases. I think.
Well, I'm glad to have you in the corner in our fight.
Karen?
Yes,
I
Dr.
want
Jim.
to jump in about that point. It's unbelievable how irresponsible some people are, who may know they are PUI, person under investigation, or might even be COVID positive, but still go out. You know that there are almost 70% of people who break quarantine. And it's shocking.
Wow.
That Malaysians do this. I'll give you even at the World Trade Center today, and yesterday, we had to actually tell people to open up their status because we almost had a big scare because someone who was a PUI wanted to come into the building, right? So this is how irresponsible some people are. So when you're going out in a place, you have no idea, the people around you, whether they are high risk. So this is why we've come up with something called HIDE. You may have heard a lot of news about that. And HIDE is really important because it's not just detecting hotspots, but instructing people what to do, disabling just a web check-in, but looking at the status of the person before they're allowed in. And I think if you are going out to a mall or a restaurant, and if they don't ask you to do that, then please, tell them it's their responsibility, not just to tell people to scan in, but to look at their status, because you've got to stop people who are, having that orange status to come into any, place where there are people. So I think this is something that, we all have to be very conscious about.
All right, spot on. Dr. Jim, another question following that. Again, a friend of mine is due to be vaccinated with the Astra, but he is tagged as having casual contact with someone who is COVID positive.
Yeah.
Do they go forward to go to a vaccination center?
Yes, if you're a casual contact, it means that maybe you were in the mall and there were some cases in the mall, but you're not a close contact. But you need to, in a casual contact, you're supposed to watch out for your symptoms, take precautions, wear a mask, watch your physical distance. And, and that's very important. If you have symptoms, then you have to quickly, seek help. But casual contacts can come for vaccination.
Fantastic. Thank you so much. Another question. This person is wondering if going to hair salons are safe since they are indoors and air conditioned. Well, for a fact, but beauticians, beauty parlors, hair parlors are not considered essential services. They are shut at this present time. But when they open again, what are your thoughts, doctors and Serina, about going into hair salons?
I personally, I think hair salons are pretty safe. I think as long as you wear your mask, the hairstylist wears her mask, you're not talking to each other in loud voices, and you're going to cut your hair within an hour, I hope, and you're out of there, or even slightly longer. I suppose it's fine.
30 minutes for most of us.
So the other thing with hairdressers is they're constantly having soap and water and stuff, right, which the virus doesn't like. And I think if you're masked, the hairdresser is masked, there's a lot of shampoo and stuff going on. The risk is very low.
Yeah.
Okay.
Unless we all sing in the
Don't sing.
Barbershop quartet.
Yeah.
Just not go for the massage. I think that's the thing that you have to stop.
Yeah, absolutely. Okay. This is a very pertinent question, doctors. Your advice on the opening of daycare for dementia clients, as well wearing a mask and social distancing is difficult for dementia patients. Oh my gosh, this question strikes home a lot to me because my mother, as you all know, is Parkinson's, dementia, Alzheimer's. It's been very, very tough for people who are taking care of patients like that and who do not have the respite of daycare anymore because these centers are shut. And for their own good also, because you can't tell somebody who's not listening to reason to keep their masks on, especially, weigh in on this, please, Dr. Sasheela and professors.
Yeah.
That's a Prof. You want to take that?
Tough one. Yeah, we've had numerous outbreaks of COVID-19 in nursing homes. I think, Sasheela, if you recall, our first outbreak in the hospital was in the geriatric ward. You know, and that created a lot of problems. So I think, you know, all those structural changes that Serina talked about earlier, as much as possible, you know, all that opening windows, etc., etc. You know, and the staff, I think, should be given priority to vaccination. Of course, the residents themselves, but beyond that, I don't think there is any magic bullet. I mean, in the US, they've advocated frequent testing, but I'm not sure that that's the answer either, because as you know, these sorts of testings are not really foolproof and not very pleasant either. So yeah, no easy answer, but you know, at the very minimum, all those things that we talked about earlier, and vaccination.
Absolutely. This is again.
Sasheela, I don't know if you have anything else to add.
No, Prof. Exactly that. I think vaccination, and you know, if you can keep them outdoors rather than indoors again, you know.
Yeah.
But otherwise, yeah, again, vaccination.
Dr. Jim, you know, one thing that I think we love so much about you is your ability to emphasize and empathize with people. Perhaps a few words of comfort and assurance for this person who asked, what is your advice on the opening of daycare for dementia clients? We're worried, as most of our elderly are still not given a date for vaccination. Our staff are also not given a date as of yet. I think you're the best person to take this question.
Yeah, I think that's a really important question. I want to say one thing. We have to get the older population vaccinated. And I see a question before as well about a 61-year-old. You know, we've been pressured that we didn't have enough volume of vaccines, but you know, it's really stepping up from June. I can assure you that. So what we're going to do is shift our strategy, you know, to really focus on the elderly people with comorbidities. But at the same time, you know, we also know that the majority of cases that are positive are between the age of 20 to 40 years old. So they're also very important to vaccinate. So what will happen is that, in fact, I've taken that responsibility now to work with, you know, our ministry that knows where the elderly care homes are and where these special centers are, and really target them and quickly get them vaccinated. We've got to mobilize the private sector, the NGOs, anyone, retired nurses, doctors who can actually give vaccinations. And then, you know, and try to get them through as quickly as possible, because if they fall sick, they fall really, really sick, right? The second thing is that, you know, keep your elderly people at home and safe. Don't expose them. You yourself have to practice, you know, really observing the SOPs so that you minimize the risk to them. And as much as your children want to hug their grandparents, it's not time yet, right? And so I think, bear with us. We're trying to do everything as fast as we can, but I can assure that the next batch of AstraZeneca is going to really prioritize the older people, and we're going to get about 1 million soon. So, you know, that's quite a large number that we can start prioritizing.
Okay, thank you so
and
much.
there was a question also about an 86-year-old mother who's going to get her vaccination soon. So first of all, congratulations and thank you for doing this for your mom. Take care of them just as you would for any kind of vaccination, right? They may have a little bit of pain, a little bit of fever, you know, watch out for that. You know, let's hope she gets protected quickly.
Wonderful. Thank you. Okay, fine, ladies. Final ventilation question, Dr. Sasheela. Is there any medical evidence or advice for or against the use of air purifiers as protection against COVID?
I think currently there are studies undergoing on the use of these air purifiers for COVID. One of it, I think Serina has mentioned about the ultraviolet germicidal. So for TB, it has been used where they put it at the upper part of the rooms, very close to the ventilator to purify the air. But you know, all these things, you need to use it with caution. And it has to be done by specialized people, because the amount of ultraviolet radiation that comes out, you know, the dose has to be right, so that and it has to be high enough, because you know the side effects to the public or to humans, you know, it can cause cataract. High doses can cause other sort of side effects. Also, I think there were other you know, things like ionizers, you know, used as purifying agents. I think these are all being studied, but whatever that's being used, it has to be done cautiously, because some of these, you know, the byproducts are ozones, and I think Serina will be able to say it better. But you know, these things have got side effects or it should be given at certain doses and be used in caution, because it can cause effects on human health. So I think studies are underway, but I think the best thing what we have right now is modifying our HIJJAS system, which is our heating, ventilation, and air conditioning system, as Serina said, to improve the airflow and so on and so forth. I think optimizing that is very important right now, and the others are just adjunct sort of things that you can think about.
Well, yeah. I think one of the listeners have wanted to know. We're talking about just those standalone plug and play air purifiers, you know,
the portable HEPA filters.
Yeah, not change mange, you know, the ones that have.
Oh yeah. HEPA fan
portable HEPA
system.
filter. Yeah.
How are they for prevention of COVID?
So the portable HEPA filters, currently there's no studies that shows that it reduces you know, the transmission of COVID, but it is being used as an additional sort of precaution in rooms that do not have proper ventilation. And just by the fact that to reduce or to filter the air that is contaminated, as usual, to reduce the concentration of the virus in particulate. But we need to be cautious, because the portable HEPA also, I think Serina will be able to say it better, but it depends on the size of your room as well. So it's not one portable HEPA filter fits all. And also where you place these HEPA filters, and you should make sure it does not, I suppose, interact with the actual ventilation that's going on and things like that. I'm sorry, I can't get the right terminology, but Serina will probably say it better.
Yeah, no, I mean, it is, they do say consider portable high efficiency particulate air or HEPA fan filtration systems to enhance air cleaning, and locating it in specific locations. But I think paramount to which is the most practical method, is really just to look at introducing and increasing the outdoor air exchange and improve the central air filtration system. The rest are really add-ons. So I think, you know, this is the most practical method to go by, and it has the less of any effects that you have to be concerned with. So I would just be going for increase of the introduction of outdoor air exchange and improve central air filtration. Yeah.
Fantastic. All right. You know, viewers, Facebook viewers, we thank you for that very, very interactive session. There was a question to Tan Sri Jamila: is it possible to submit the suggestions by the panelists to the relevant authorities for their consideration and action? I would like to say that we have relevant authorities sitting in this very panel. So the answer is, on behalf of Tan Sri Jamila, yes. She will gather them and she will present them to, well, her boss. There's only one other better authority right here.
Well, actually, it's not as simple as that. I think all these questions are really important. I think we as a group, Adiba, myself, you know, certainly have been working very closely with all sorts of discussions and all sorts of suggestions that we give to the different ministries as well. I think, you know, we will do that. We will continually do that. But I also want to say, you know, it's easy for us to talk about these things, but if I give you a simple example of school closures, you know, for people like us, we could probably afford it if our children are not in school, right? Because they are in the urban settings, they have good Wi-Fi connection, they can do all sorts of online learning. But we have a real challenge of those who don't have, where they have maybe one device to be shared with a number of kids. And these are the realities. I think COVID-19 has really stripped bare the unfortunate social dimensions that contribute to how we come out of this pandemic, right? And we really run a risk of a lost generation that has missed school for more than a year. So these are realities that have to be dealt with. I think that we will continue, at least I know Adiba and I will continue to make a lot of noise and keep pushing for really using science and evidence to guide us in our decision making. So I think this is going to be really, really important. But we can only advise, right? This is our role.
Taking your advice, I think we can actually influence the industry by putting it out there to the Malaysian Green Building Council, educating our other industry players, as well as to the architectural fraternity and the mechanical and electrical engineers, etc. I think we can actually get that out pretty fast out to them. So I think we will do our part to do that as well, in order for the industry to be responding to this changing world that's happening to us.
Thank you, Serina.
Thank you, Serina. I think
That's
that would be
great.
a great outcome of today's discussion. I think if the relevant councils come up with standards and guidelines, because it is not just about it is about reducing the number of COVID infections that we see, but also in returning the restaurants and all that back to normality. I'm dying to go out to eat in a restaurant safely. That's udang sebalik batu here.
Well, for seeing a lot of owners, friends that own places struggle, try to do the best that they can. I know the reality is real for them, suffering in terms of putting food on the table, literally. It's been a problem. So,
Adiba, sorry. You would have heard a lot of noise in the PA system, sorry, and people are still coming in for the vaccine.
No, we can't.
Yeah, it's kind of sad that my date nights with my husband and I in a vaccination room is the only time that we can spend time together. So since we're working till late at night, I've pulled him in to help me vaccinate patients, vaccinees as well, which is kind of fun.
Yeah, bless him. He's an awesome, awesome person, a doctor of very, very high water. Ladies, we've come to the end of the session. Could you just round us up on your final thoughts? Dr. Sasheela, thank you for being on the show. Serina Hijjas, you were wonderful and an ace non-medical panelist. Thank you. Could you ladies perhaps give us your final closing thoughts, and then Adiba and Tan Sri will follow.
So I would just like to say that, we need to use all the tools we have to, I won't say combat COVID, but to live with COVID, because this is another respiratory virus that we'll learn to live with until we all become immunized or immune to it, just like all the other respiratory viruses. So please, hand hygiene, social distancing, wear your mask, proper ventilation, and vaccinate. I think this is the only way we are going to go back to some form of normalcy. Thank you, Dr. Sasheela. Serina?
We have to be grateful in Malaysia for proper sanitization, clean water, 365 days of tropical weather, but we have been complacent on our social distancing, our self-sanitization to control clusters, and the need to stay 6 feet apart. I think just a gentle reminder, I'm saying this out loud just in case my kids are listening, that it affects all of us. And so I know for all your frustrations that are out there, just know that we are all in this together. And so we can only make it through this with a combined effort to maintain this. Thank you.
Professor Adiba.
Yeah, so the situation is pretty serious at the moment. You know, with us having not just us at University of Malaya Medical Center, but even more with our colleagues at Ministry of Health, having to open more and more wards, more and more beds, more and more ICU beds to cater for those who are getting infected, and also our colleagues on the public health side trying to catch up with testing and contact tracing. It's you know, it's an enormous, not easy task. So please make our work, whether at the hospital or at public health side, a lot easier. And you know, as what Sasheela has said, you know, all those things that we harp on, there is a reason for it. We don't want to see any of you as our patients, really.
Over to you, Dr. Jim.
Yeah, first of all, I just want to say thank you so much to Sasheela and Serina. It's such a pleasure to have both of you, and we all learned so much from both of you. I think, you know, everyone has said such important things, but I think, you know, I want to say that it all depends on each individual. It's not just, you know, Professor Adiba and Sasheela working on patients in the infectious wards. Every single person in this country now has a huge responsibility to behave in a way that will not put anyone else at risk. You know, I think that, you know, we have to stay at home as much as you can, keep yourself safe, you know, and please, you know, if it's one thing that's so dangerous, it's the not wearing a mask properly, not just not wearing a mask properly.
Indoors.
And, you know, especially when you're indoors, and also, you know, really maintaining a safe distance away from each other. These are two very simple things that we need to persevere, even though it's really, you know, we're all tired of it, right? But until then, unless we really persevere and stick to it, I think we'll be, you know, having a lot of problems. I feel so sorry for the frontline workers. I spent my Hari Raya morning at Sungai Buloh Hospital, feeling so guilty that, you know, my medical colleagues were having to work the way they work, not just in Sungai Buloh, everywhere. And I think that, you know, it's so easy to say we value frontliners, but I think we can value them and show how we value them by really taking all these precautions. And please take the vaccine. This is the only way we can get to herd immunity. Thank you.
So this has been your weekly dose of Sense of Science. You've been listening to Serina Hijjas, Dr. Sasheela Ponampalavana, Tan Sri Dr. Jamila Mahmud, Health Advisor to the Prime Minister of Malaysia, and Professor Dr. Adiba Kamrul Zaman. I'm Karen Michaela Tan. Until next week, stay safe, Malaysia. Stay home, keep the windows open, your hands to yourselves, and your hearts open to the needs of others. Thank you for joining us. Goodbye.
Thanks,
everyone.
Thank you.